Welcome to On Track. I'm Aisha Jaffer. This week marks 5 years since the COVID-19 pandemic devastated the world, bringing life to a halt. As we reflect on this pivotal moment, we look back on the challenges, the triumphs, and the lessons learned. Today, what has changed over these years? What are we still grappling with? And as we move forward, what can we do to prepare ourselves in the future? Today, we're joined by two guests who've been on the front lines of our response here in Louisville. Dr. Mark Burns is an infectious disease specialist at U of L Health and an associate professor at the University of Louisville School of Medicine. He earned his medical degree and completed both his residency in internal medicine and fellowship at U of L Health and U of L Hospital. Dr. Burns is board certified in infectious diseases by the American Board of Internal Medicine. Dr. Burns, thanks for joining us.
Thank you so much for having me.
We're also joined by Taylor Ingram, Chief of Staff at the Louisville Metro Department of Public Health and Wellness. She played a pivotal role in the department's emergency response efforts, serving as Section Chief for the Incident Management Team during the 2017 Hepatitis A outbreak and the COVID-19 pandemic. Taylor holds a Master's of Public Health from the University of Louisville and a Bachelor's in Public Health from Indiana University. Taylor, thanks for joining us on Track.
Happy to be here.
So this is a question for both of you. It's the 5-year anniversary of the COVID-19 pandemic. And to be honest, when I say that, that doesn't seem that long ago, but for others, it might feel like a lifetime. How do you feel? And did you ever think we'd be where we are today? Starting with you, Taylor.
I think it's both and. I think that there are moments that make it feel like it was so long ago. And then there are other reminders that make me feel like it was 5 minutes ago. So very happy to be on this side of things and continue to use a lot of the lessons that we learned during that time in our current practice.
Dr. Burns?
I feel exactly the same way. There are times when it feels like it was eons ago, but at the same time, we're still living with it, albeit in a better place. And right now, I sort of have the feeling that we've learned a lot, okay, but there are a lot of things, a lot of problems that still exist today, not necessarily from the COVID per se, but maybe the mechanics of getting a diagnosis and actually knowing a treatment, knowing what to do, and getting people to comply.
Yeah, and we're going to dive deeper into those lessons and maybe things we've learned so far as we reflect back. Dr. Burns, is COVID still a global pandemic, or has it truly become an endemic part of life, kind of like the flu?
Well, and according to the World Health Organization, and by the way, I do agree with the way they describe it. No, it is. I don't think it's no longer. I don't think it's longer a pandemic. I think it's more endemic, so to speak. The numbers are down across the globe. We have treatments for it. So we're definitely in a much better place, and I don't think it's as widespread and certainly not nearly as deadly as it was when it first started.
So locally, risk-wise, where should COVID-19 live in our minds?
I would actually, I want to categorize it to be primarily maybe around the flu type that is in, if there's such a category.
Right. Yeah. And that makes sense because we all grew up with that, thinking about that, getting the flu shot, and that's sort of just way of life, right?
That's correct. Mm-hmm.
So, Taylor, I want to ask you, what did the city of Louisville learn, and what has changed in how we handle public health crises in the last 5 years with COVID-19?
That's a complicated answer as far as lessons learned. There's so many different layers to that. So, we prepare for these types of emergencies on a routine basis. That's part of what a health department does at its core. We learned a lot about how to adapt to something that was brand new. So many of the plans that we have built are for viruses and diseases that are long studied, and there's a really strong evidence base. So we learned a lot more about how to take in information in the moment and quickly apply that to our practice. We learned a lot about the strength of our partnerships. There's so much work every day that goes into building new relationships, maintaining those relationships over time. And in those moments, like in the depths of the pandemic, you really understand the value that those bring. Like Dr. Burns is a great example, being able to rely on each other's areas of expertise, coming together, how much stronger that makes us, and then the way that we are able to approach different communities in Louisville through those trusted relationships.
Dr. Burns, kind of same question to you. What do you feel like in the medical realm, like we've learned from this pandemic in the last few years?
Well, we've learned that first of all, there's no situation that's insurmountable. Okay, and if we apply basic principles, because if you think scientifically for a second about viruses, how they work, how they rely on us to reproduce, but at the same time, what their weak points are, and knowing about variants, that is how viruses try to protect themselves, but how we can try to get ahead of those types of things. I think from that standpoint, we learned those types of lessons, and I think in a positive way, we learned that. We also learned, however, that there is a lot of skepticism, particularly when it comes to physicians, when it comes to vaccines, when it comes to public trust. A lot of skepticism there. So, and what's interesting, I know for me, I used to think it was a no-brainer. Basically, you have an issue, a disease, but there's a vaccine for it, and you get it, and then you're protected, and you just move on. I think COVID sort of exposed some weaknesses. It also, to me, exposed some of the past resentment and the inability for people to sort of trust, again, providers based on lessons from the past.
Yeah. Well, I actually do want to talk about kind of media public trust, because Dr. Burns, you made numerous media appearances throughout the COVID-19 pandemic to help explain the science and the risks behind the virus. How important did you think that was for public figures like yourself to step up during this crisis and guide the public through such a turbulent time?
Well, I think it was very important, especially those of us who had expertise in the area. It's good that physicians talk about it, but to me, the physicians best suited to speak about that is someone from infectious disease, of course. But yes, I thought it was extremely important, for that to occur. I believe if the public knew of our backgrounds, that this is what we do, so we understand what's going on, and any recommendations. Well, first of all, anything we tell you about it, from the best of our knowledge, will be truthful, and then secondly, again, from the best of our knowledge, we're going to guide as to what we recommend and we think is the best course to take.
So, Taylor, looking at the pandemic from a global perspective, what do you think are the biggest lessons learned from the response to COVID-19?
Yeah, I think one of the top ones that we would have to mention is the necessary investment in public health infrastructure. If there weren't the funds to be able to supplement our day-to-day efforts, if we weren't able to quickly staff up, to be able to provide some of the additional supports that our community was telling us that they needed beyond just the vaccines themselves, the community would be in a very different place today. So while we can appreciate that support in the moment, as time passes, support for the public health system globally may change. And we need that continuous and strong investment to be able to be here for our communities on a day-to-day basis and to be able to step in when there are emergencies.
Dr. Burns, anything to add?
Oh, no, she said it perfectly. I agree with every word. I think it's extremely important. I think knowledge, having the knowledge, and also being able to pass the knowledge on to others. The big thing I tell people all the time, when the pandemic first started, of course, it began in Wuhan, China, but it spread across Europe And those things that happened in Europe were happening before we got to the United States. I remember several discussions I had with some of my colleagues that in Europe they were having problems with, let's say, like having ventilators for the people who were truly sick with respiratory distress. They were running out of ventilators. And so we kind of knew it's like, well, this is definitely headed our way. And this is something that's not just going to go away in the spring or whatever, then we need to better prepare ourselves for it because this was not going to be good.
So what lessons do you think we still haven't fully learned, though, looking back? Is there anything else we need to think about?
Well, one of the things that sort of distresses me a lot is the fact, I'm sure you're aware that the current administration of the United States is not partnering or joining with the World Health Organization, which I think is a humongous mistake. I believe being partners with them, again, sharing knowledge about in this particular case, it was COVID, help better prepare us, as physicians as to what to expect and maybe how we could begin to approach this disease. What would be the first steps, knowing that, again, from information that we had received from the World Health Organization.
Taylor, is there anything you want to add?
Yeah, I think Dr. Burns touched on it a little bit earlier about the power of history and how that shapes people's current experiences and trust and the power of misinformation. So I think that we've learned a lot about both those topics. I think we're all really working to incorporate that into our day-to-day work and our future plans for emergencies. But I think that there's still a lot of work there that needs to be done and a lot of trust and relationship building.
So considering everything we've talked about, what strategies are in place locally to ensure we're prepared for a potential new pandemic?
Yeah, absolutely. So at the Department of Public Health and Wellness, we have an emergency preparedness team. And so we have a whole list of all of the potential emergencies that we might face and plans in place of how we would tackle each of those. It's a really strong foundation to be able to build on and to be able to think about those topics before the moment hits so that we can anticipate what our needs might be. We keep a stockpile of a certain amount of supplies on hand at all times so that we would be ready to go if something happens overnight. And then once again, a lot of the work in the community to help people train and prepare themselves for those events as well.
Well, Dr. Burns?
Oh, yeah. Well, I know from a medical standpoint, and hopefully all physicians are doing this, of course, being aware, knowledge of things that are out there, potential things that can come and affect our community on large scale basis. Perfect example now would be the bird flu, which is out there, H5N1. Although at the present time there have been no human to human transmission cases, there are cases that people have gotten from, either poultry, dead birds, or from other birds. And knowing about that, hopefully, there'll be no human to human transmission. But again, just being aware of it, that potential can happen and thinking ahead of some steps, perhaps what to do.
For sure. Well, thank you very much. We'll be back in a minute. You're listening to On Track from Louisville Public Media. Springtime is just around the corner, and it's not too soon to start planting your garden. Maybe you're wondering if your spot is sunny enough to support sweet peas, how to make your rosebuds abundant, or when to prune your poplar. Ask our master gardeners. Call or text 502-814-TALK. That's 502-814-8255 with your questions for On Track's Spring Gardening Show. Welcome back to On Track. I'm Aisha Jaffer, and today marks 5 years since the onset of the COVID-19 pandemic. We're taking a moment to reflect on this pivotal time with Dr. Burns, infectious disease specialist at U of L Health, and Taylor Ingram, chief of staff at the Louisville Metro Department of Public Health and Wellness. So, Dr. Burns, to what degree during the COVID-19 pandemic were the mRNA vaccines a game changer, and how do you see their long-term impact?
Oh, to a huge degree. Because the mRNA vaccines, that was the actual first time those type of vaccines had ever been manufactured. Traditionally, they made vaccines. They would put them in eggs and just kind of watch and see how they progress from that point. And then you had testing, you had clinical trials, and we're talking years to even get a vaccine approved. With the mRNA vaccine, that was not, I can't think of anything more than a game changer, but that's what it was. First time ever, they got approved extremely quickly, but they also had been shown in their brief clinical trials to have 90+% efficacy in how they worked. And given the pandemic, at one point, millions of people had been dying from COVID, we had to do something. We had to do something at that point.
So now with Robert F. Kennedy Jr. now leading the Health and Human Services Department, how do you foresee his past views on vaccines potentially influencing national vaccination policies and public health strategies in the event of a future pandemic?
Well, I did see some of the confirmation, and he sort of rescinded, if you will, his view on vaccines. Now, whether that was he was true about it or whether it was just to be confirmed, I think that's yet to be seen. But I will say this: vaccines are important. They have been proven to help curb and eliminate disease. They have been proven also to be safe and effective. And I would hope that that vaccines, the development of vaccines, would continue as they have before.
Taylor, anything you want to mention on that note?
Yeah, I think there's a really strong evidence base for the vaccines that we have available. We have seen diseases and viruses that impacted generations before us be almost eradicated. And so at the department, we feel really strongly that we want to continue to make vaccines readily available to anybody in the community that is interested in receiving them.
And Taylor, for those still hesitant about the vaccines or boosters, what communication strategies have you found most effective in addressing vaccine hesitancy among the public? And has this approach evolved in the last few years?
Yeah, one of my favorite projects that we did during the pandemic was called listening sessions. And so we identified leaders across our community that had deep connections to different populations and be able to speak from their own experience about why vaccines were important to them, why they had made the decision to get vaccinated themselves, to provide that evidence-based information so that people could make the decisions that felt right for them, and then to be able to have an open and honest dialogue about questions and concerns that were remaining to them, to help them inform their own decision-making.
And what policy measures do you believe are essential to strengthen overall public health and ensure community immunity beyond just vaccines?
The requirements that have been placed in different institutions like school systems and employers do encourage vaccination and help promote that herd immunity to protect communities at large. And I think the ability for departments like ourselves, for others to be able to readily share information about vaccine availability and safety.
It sounds like I'm hearing from both of you. Transparency is really a big part of it.
Oh, absolutely. Transparency. I think having trusted messengers.
Yes.
People that know what they're talking about, so to speak. because as Taylor indicated before, and even today, there's still a lot of misinformation out there. But hearing from trusted messengers, but I also believe accessibility is important as well too. That is, being able to get the vaccines. You can know about them, but it's like where do I go to get one? And I think it has to be accessible. There can be potential barriers to that. People may have transportation issues, maybe communication issues. There are potential barriers. So I think that's important to consider as well, too.
Dr. Burns, I wanted to talk about something we've recently seen in our community, which is a rise in cases of COVID-19, not on the level, like the pandemic level, but there's also RSV, influenza, and norovirus, what doctors were locally calling a quademic. So looking back, how did we get to this point, and what lessons can we apply from the last 5 years to better protect ourselves and our community moving forward?
Well, to tell you what I know, first of all, those viruses have all, maybe with the exception of COVID, prior to the last 5 years, those viruses have always been present, been around. And typically in a winter season, you're going to see an escalation or an increased prevalence of viruses, primarily because the weather's cold. People are going to try to congregate inside. And in doing so, you're in close contact. And, people can actually spread viruses like that. Now, to speak specifically for a second, if we talk about the RSV and influenza, which, by the way, influenza this year has exceeded far and beyond COVID numbers. We figured there would be an escalation of respiratory viruses, but flu has actually made such a comeback. Because our attention has been, and rightly so, on COVID and preventing COVID infections. But influenza, RSV, and COVID, the respiratory viruses of this, a lot of focus has been on those. The great news also, by the way, is we have vaccines for all three as well too. So that's really good. The norovirus is more of a GI type virus, gastrointestinal. People usually have like nausea and vomiting, diarrhea, maybe some fevers, chills, and there's not necessarily a vaccine for that, because of the type of virus it is. But I believe that especially with the influenza and also norovirus too, because those numbers have been low for such a long time, and because we're coming out of COVID, people are congregating again together as they were prior to COVID. It's only, to me, inevitable to see an escalation of those types of viruses.
Yeah, admittedly, I was one of the winners of influenza. Well, now that we're looking to the future, Taylor, I'll start with you. If another pandemic were to happen in our lifetime, how do you think our response would be different?
I think we would start with a more tailored approach to our communities. I think there were a lot of reasons that we started with a mass vaccination site. We needed to get as many vaccines out in the community as quickly as possible. And to many of the accessibility barriers that Dr. Burns mentioned earlier, as the response evolved, we went to a more community-based approach. We did more mobile vaccines, finding more community-based locations, and that seemed to make it a lot more accessible for people. And there was also a trust element that we were in their community versus them coming to a centralized site that they may not be familiar with. So I think we would more quickly move to that type of model. More
of a tailored model. Dr. Burns, anything you would say about how our response would be different for an incoming pandemic?
Well, of course, plus given the fact that I believe the last pandemic we had was in 1918 with the influenza at that point. 100 years, you become a little lax on things,
right?
but I think what we can, I think our approach and what we would do different. Well, I think differently is that, again, now we have experience with it. I think we would get protective measures like the public health mitigating measures, stressing those things more, at least more prevalently. In addition, now we have not only vaccines, but we also have treatments, for something like COVID right now. I think developing, if we need new vaccines, I think the mRNA has been, as we just spoke, has been a game changer, and I believe that technology could potentially be used for if we have another type of viral pandemic, that we'd be able to develop vaccines quickly again like that. But then eventually treatments, for whatever, if there's another pandemic, whatever those organisms are.
And I have to ask, as a reminder, Dr. Burns, what can we do to prevent the spread of disease?
Let me see. I think vaccinations. I think first and foremost, vaccinations are probably the most important. Getting people vaccinated. And then also, and I always, whenever I give talks, I always stress public health mitigating measures. I think they're sort of underrated, if you will. But to give an example, how I think important it is, if you remember, right before COVID, we had large numbers of people being infected with the flu at that time. You might have heard stories about people at hospitals in parking lots, waiting to be triaged, for their flu-type symptoms. Well, when COVID came along and we started stressing wearing masks, if you look back at those numbers, like from 2020, 2021, those numbers fell precipitously. Okay. And that was primarily because people were wearing masks. Okay. So, again, part of the public health mitigating measures. I think they're underrated, taken for granted, but I think they're extremely important. And I think whatever comes up, whatever, especially viral type issues may come up, I still think those measures in place will help.
Well, Dr. Burns, Taylor, thanks for being here on Track.
Thank you for having me.
Yeah, thank you so much.
Dr. Mark Burns is an infectious disease specialist of U of L Health and an associate professor at the University of Louisville School of Medicine. And Taylor Ingram is the chief of staff at the Louisville Metro Department of Public Health and Wellness. On Track is a production of Louisville Public Media. The On Track production team includes Michelle Tyreen Johnson, Jacob Munoz, Alex Biscardi, and Laura Ellis. If you're just tuning in and you want to hear the full show, you can find it now at LouisvilleOnTrack.org or in your favorite podcast